Good evening, everyone. It's Wynn Brown with Heywood Healthcare's COVID-19 update for January 15th, 2021. 2 weeks from our go live with our new electronic medical record. Very busy across the whole organization, especially the two hospitals and our urgent care facilities and our testing. As I mentioned, I think last week, we are testing 3,000 community members a week, and it is a huge lift for us, and I appreciate all the staff who are making all that happen. So thank you very much. As we talk about testing and we look at our numbers, you can see that the average for us throughout the pandemic is 4.1%. Versus the state at 3.6. Our 7-day rolling average, which is really more current data, is a snapshot for what's going on right now. You will see that we are at 8.65% positivity versus the state at 6.67. So we continue to be very high in our positivity rate and are one of the leading communities, unfortunately, in the region and in the state. So just to call out to not only our staff, but really the community members who see these videos to make sure that you're doing everything you can. We have a total of 25 inpatients at Heywood Healthcare right now, 5 of whom are in our ICU. So that is a very high number for us and puts a huge stress across not only the Heywood Hospital, but across the entire system. And so what more the community can do to make sure that they're doing all the precautions that are necessary ultimately lowers the burden on the health system as well. So just a call out, my continual call out to everyone to do the right thing so that we can continue to care for everyone. You'll see that there is a chart embedded with this video so you can see by town the positivity rate going on. In regards to the vaccinations, we have administered more than 1,300 vaccines to our staff in the health system. We have gotten another small shipment from Moderna, and so you will get communication next week. If you have not yet received the vaccine and would like to, we're going to push out the dates and times for that, a little different format, so that we're going to tell you when it's going to be, and then you can sign up if you have not gotten the vaccine yet. And I really encourage all staff to make sure that they get the vaccine. I know that some people have some concerns about it, but I think it is incredibly safe. I have gotten it because I think that it's the right thing to do, and I hope more and more staff who have not yet opted to take the opportunity to get the vaccine do so. In speaking about the vaccines, there were a couple questions on Ask the CEO button that we have on our intranet about staff who have family members and loved ones that they would like to see get vaccinated right now. And so there is a slide here embedded as well to talk about the phases in the community for people to get vaccinated. Obviously, we'd like to vaccinate everyone that we can, but we have a very small supply. And the challenge of part of this pandemic and the way that the vaccine program is being rolled out from the federal level down is we just don't know when we're going to get vaccine and how big our shipment will be. And so that is a huge, huge challenge for us. And one of the what's the right word? Not as well orchestrated pieces of this pandemic that we are dealing with, and we're at the end of the food chain on this, trying to make sure that we can do everything we can. Don Casavant did have a conversation today with the Gardner Board of Health about vaccinations, and we have a call next week with the rest of the local boards of health just to make sure that we are well coordinated and can be supportive as possible in the process. So thank you for your patience, and if the timing of things change or the amount of vaccine that comes available or the phases get adjusted, we will obviously do our best to pivot on that. And I know it is frustrating for everyone, but that is just the situation we are in at the moment, and we'll obviously keep you apprised as they develop and we have more vaccine available and the phases change or progress. And as you've seen, there have been some changes in lowering ages down to age 65 and those kinds of things. So there's also some vaccine education embedded with this. If you have not yet got the vaccine and you want to know more about it, we've embedded some vaccine for you. A couple other questions came about asking about surge planning. Obviously, we have 25 inpatients in the system right now, and obviously our high positivity rate. We do have a surge plan for both hospitals to make sure that we can put more beds online. Obviously, it begins on the Heywood campus in particular, adding more beds onto Watkins 1 to make sure that we could double up beds there if we needed to, spilling down later on into the day surgery and PACU area. Again, having beds and being able to staff them are two very different things. We have been using the DCU Center for some transfers and then working hard to make sure that we can transition patients to different levels of care if that's appropriate. So we're doing all those things, but rest assured we do have a surge plan. We actually did some recent updating to that as well. On some very positive note, earlier this week, Mike Nicholson, our mayor, held the State of the City address, and he also gave out some awards. And for the first time, Gardner awarded 2 individuals who are not residents of the community with honorary citizenship, and that is Dr. KP and Dr. Mohan, and they were recognized by the city for their incredible work throughout the pandemic, and it was just really a wonderful opportunity to have a couple of our very own honored and recognized for that. The video link is embedded here, and at a minute 45 and 30 seconds about is when the 2 physicians are recognized. So please click on to that if you didn't watch it live. Continuing on the theme with the city and the mayor, earlier this week we authorized and signed the lease for what we call Parcel 12, which is off the south lot that the city is leasing to us so that we can begin to formally move forward with our surgical pavilion, which is 6 new ORs, a new entrance on the south side, and some medical office space. And so that project is running in the background, and the planning and design is happening in the background, even as all these other things are going on, with our hope that we will be breaking ground on that this fall. But really a shout out to the mayor and city council for their support of us. It really is incredibly important for our continued success and vitality and independence. So a shout out to our community leaders for making sure that their community hospital is supported, and we appreciate it. I know everybody's working hard, and it's when you give a shout out to somebody, everybody else says, what about me? How come you didn't give a shout out to my department? We are happy to give shout outs across the board. But today we did have a note from Amy Wheeler from the lab just to thank phlebotomy staff for their tremendous work. And again, I know everybody's working hard across the system, but Amy asked me to give a special shout out to them. So that's what I'm doing, and I'll give some more shout outs down the road. So we also had a really nice note of thanks from one of our physicians who is a member of our staff, who said, I want to thank everyone at Heywood Healthcare for performing so honorably during this horrific infectious disease crisis. I speak with my friends and colleagues all around the country who are struggling without the level of support and communication that Heywood has provided to our medical staff and the community. Our ability to adapt quickly and be nimble in the midst of this crisis is evident every day, from the supplies of PPE to the speed at which Heywood has made vaccines available. I'm proud to be a Heywood healthcare physician, so thank you very much for that. I know everybody, and I've said it earlier, is incredibly stressed and very tired, and we don't see an end to this journey, and we have a new electronic medical record launching coming up. There's just a lot of pressure on us apart from the pandemic, and so we do have a self-care video link here on how to push pause, and so it's the Power of Silence video, and it's just there for a little self-support for everyone, and I encourage you to take a moment and learn from that and find a way to push pause for yourself as we continue our journey to be one of the best community-owned health systems in America. I hope you all have a great weekend, and thank you for all you do to take care of everyone and keep them well. Take care.